a pleasure to introduce Jim Martin, the Chief of Medicine, a man of enduring wisdom. Jim.
Thank you very much for inviting me. Mindfulness is clearly not something that is easy to define, and I enjoyed reading both an article that Tom had written and also what you'd written, Patricia, in the book. One of the phrases that I noted in the book was the idea of shutting out the internal dialogue as being an important aspect of mindfulness, and I think that we are assaulted by these internal dialogues that are sort of triggered by the frustrations of the practicality of simply working in offices right now. Clearly, as clinicians, we need to be present. We need to listen, and I think that the notion also that mindfulness has a self-care aspect to it in relationship to the physicians and training physicians is an important aspect which we also need to attend to. So I would like to sort of finish by congratulating you on this work. I think it's very interesting because it allows a person who's not necessarily briefed in the vocabulary. It does give you an access to the domain by case studies, as it were, experiences that are recounted and so on. So it's easy to connect with it. And I hope it has a great deal of success, and I certainly look forward to your presence within the department and the whole personal care group. So thank you very much, congratulations, and I'm sure this will seed many more projects, and that it will be, that it will hypertrophy and have an important impact on us all. So thank you very much.
Patricia, just to say, she's been involved in whole person care since the beginning. She's played a huge role in terms of the development of mindfulness courses for healthcare practitioners and for patients. She's written or edited this book. You said this will lead to more things. It's already leading to a second book and apparently even a third book. It's almost frightening, but good news. So I'm very interested to hear Patricia talk a little bit about the book and perhaps read a little bit from one of the chapters. So Patricia, congratulations.
Well, first of all, I want to thank a lot of people. I want to thank Jim Martin for reading the book and coming and introducing it and saying those encouraging words. To Dr. Hutchinson, who, along with my colleagues, I see several here, Stephen Lieben and Mark Smilovich, are really pioneers in the growth of whole person care. And not just at McGill, but in the world. I mean, Tom just came back from Japan, where he's helping people set up a program there. And so I sort of see whole person care as a place where I can teach, I can do my research, I can do my writing, and I can participate in a group that really does value working in a way that's congruent as a team with patients, with colleagues. And so it's, often in academia, there's some discomfort in departments, and it's not there for us. We really are happy to work together. I'd like to also thank Angelica, who's our administrator. She's not here now, but she organized this event, and not only did she do that, but she formatted the book. She contacted my 25 other authors. She really was a wonderful backup for this program. And of course, the co-authors. If they didn't do the work they did, this book wouldn't be here, and I have some co-authors here. I see Sonia Osario, who's here. I see Maureen Rappaport, who's here. So it's fun to celebrate that with them, and of course you for coming. And then Mark Smith, who's my mate and my niece. So I want to talk a little bit about the intention for this book, because when you're trained in mindfulness programs, we're trained to think in terms of, why would I do this? What's my intention? And so before actually writing the book and editing it, I thought about that. And I said to myself, well, we can show how being mindful enables physicians and other allied healthcare professionals offer skillful and compassionate care to their patients. So both are needed. It's not an either or. And of course, in whole person care, we promote that approach to work. And it's aligned with our mission. And so I want to just tell you the mission statement of whole person care, and you can see how these go together. It's to transform Western medicine by synergizing the power of modern biomedicine with the potential for healing in every person who seeks the help of a healthcare professional. So healing takes place both in the person who is offering the service and in the person who receives the service. So there was another reason I wanted to put this book together, and that's because we're all too often exposed to what's going wrong, such as budget cuts and problems at the Glen and burnout of staff, and this goes on. And we are hardwired to notice what goes wrong. And, that has survival value to it. But if we only notice what's going wrong, then we can become either disenchanted or even cynical. So what we can do is we can include in our purview what's going right. And there's a lot going right in medicine. And so I wanted to show through other people's stories that there's hope and there's encouragement for those who find themselves in the healthcare system in one way or the other, either working there as a doctor, a nurse, or a psychologist, or a patient, or a person who's accompanying the patient, family, or significant others. So there's really a lot of hope in this book. And I invited 25 authors from various disciplines, so we have really a wide range. We have pediatrics, family medicine, surgery, emergency medicine, palliative care. So the idea was to show that across the board, this is possible. And I actually have authors from 5 countries. And that was one of the reasons why it took a year and a half to finish the book, because I did a lot of editing. But it is possible to practice this way in the 21st century. So what I would like to do to give you a taste of the book is read an excerpt written by Dr. John Kearsley. Now, he's a radiation oncologist. He's an MD, PhD, who is deep in the science tradition of medicine, still is, but also enhanced his work in oncology through the use of mindfulness. But what's interesting is that in his chapter called Carmen's Story, he doesn't teach you about, this is mindfulness, here's the definition, here's what you should do. He exemplifies it. So I'll read an excerpt from his book. I cannot recall planning exactly what I should do. Instinctively, however, I placed my 2 hands on the sides of my chair and gently moved both myself and my chair forward, very close to Carmen, our knees almost touching, in full view of the 2 students. I sensed that Carmen required a closer presence. I saw Carmen as a shattered piece of pottery, with each jagged piece somehow cleaving to its neighbor in fragile repose. Maybe, I thought, the next teardrop or sob would be enough to cause total disintegration of her fractured self. I did not look forward to the prospect of having 1,000 shattered pieces of pottery break all over me. Carmen needed a connection. She and her fractured self needed to be held together somehow. I don't usually sit quite as close to my patients as I did with Carmen, but this time it was different. I sat directly in front of Carmen, knee to knee, as I clasped all 10 fingers and both her hands in mine. I think I was trying to hold her together. Please don't disintegrate over me. Maybe I was trying to give her a direct infusion of courage and humanity, the reassurance that all would be well. During this intense experience of presence, I was also keenly aware of how I was feeling. My pervasive feeling was that of uncertainty. Where is this going? What will Carmen say next? What might I say? Will I say the right thing? Will I just need to sit in silence with her? And yet, over the years, I recall that I have borne this feeling frequently. It happens every time when circumstances such as Carmen's arise. But it does not destroy me. I sometimes ask myself, how do I endure this uncertainty when I'd rather run away? Well, running away would be an easier option, but in bearing uncertainty and staying present, I am continually mindful of attempting to, quote, make a difference, despite the unfamiliar seaways of uncertainty through which I navigate. The words of Belford Mount, written almost 20 years ago, provide sustenance for me to stay present. You make a difference when you take the time to sit down and listen, when you stay there in the face of unanswerable questions. That's a quote from Dr. Mount. That challenge gives me strength and reassurance in situations like Carmen's every time. It means that I have to believe in mystery and develop a sense of non-attachment to outcomes over which I have little or no control. On most occasions, I have no idea as to what type of difference I make. Carmen, I said, sounds like you've had a rough time. There is a certain very private dynamic, I think, around the use of empathic statements in a clinical setting. Whether the statements used are empathic statements of understanding, respect, or support. I find these statements to be immensely powerful, particularly as circuit breakers, in the midst of those swirling emotions, both spoken and unspoken, that can sometimes cause disorientation in the clinical encounter. I use empathic statements to seek out a place of peace and shelter in the midst of the eye of a tornado. When delivered with care and sensitivity, there will always follow a silence, which can be profound, deep, and longing, moistened with silent tears. When I said, Carmen, it sounds like you've had a rough time, or Carmen, you are the only one that matters at this moment. We are totally here for you. Despite the ensuing silence, there is a conversation going on. It's just that it takes place in another silent, contemplative space where only the two of us can be, each bringing our wounds to heal or to be healed. I find it's often a mistake to speak too soon. If any words are said, they arise from deep and hidden places. This is my concept of exquisite presence. According to Buber, exquisite presence represents searing, fragmentary episodes of direct spiritual union between two people during which nothing exists, neither time, nor distance, nor place, apart from us in didactic union. I suspect that many of us who work with ill people experience episodes of exquisite presence more often than we realize, as we enter involuntarily into these healing spaces. So on that note, I would like to celebrate all these doctors and healthcare professionals who bring exquisite presence to their patients, and they are numerous. They are out there and they're in those trenches doing their job day in and day out, and they're kind of like unsung heroes. So I'm hoping this book sings a little. So with that, let's celebrate. Thank you.